Welcome to Spectacle on Television Nigeria. I am your host, Daniel Atai. I welcome you again to Spectacle today. And like I promised yesterday, I told you that we'll still be dealing with the issue of the 10,000 primary health care facilities across the nation promised by the FG, as stated by the Minister of Health, Nahiro Emmanuel Osagi. I am your host, Daniel Atai, and with me in the studio is Dr. Mavis Robinson, the health practitioner and the president of the Heal the Youth Foundation, FCT chapter, and also with Miss Aji R. Robinson, a fellow Institute of Management consultant and the founder of the Heal the Youth Foundation. Both of you, you are welcome. Mavis, welcome to Spectacle.
Thank you very much.
And Madam Aji, welcome.
Thank you for having us.
Thank you very much. The health minister of recent stated that 10,000 primary health care facilities will be revamped across the nation. That is the 36 states in the nation and across the world, not only the state. He emphatically said that the Nigerian wards, which is about 8,812 wards, will have a functional and a full infrastructural primary health care facilities. And we were thinking that how is this going to be possible within the short frame of time? But he's given his word, and we pray it comes to the light so that Nigerians, especially the vulnerables, will have affordable health care to be attended to. And after this short break, the two guests in the studio will be making justice to this particular topic. Stay tuned.
This is Television Nigerian, a broadcast network committed to serving you the very best in online and offline television programming. Situated in the serene environment of Guzape, Abuja FCT, TVN, as it is fondly called, caters to a wide variety of audience via carefully orchestrated mind-blowing programs in the areas of fashion, business, politics, entertainment, religion, movies, food and health, culture and lifestyle, events around the globe, sports and foreign news. Whatever your inclination, we've got you completely covered with programs like Issues of the Moment, The Patriot, Daybreak Nigeria, Matter Africa, TVN Business Time, Healthy Living, From the Cradle, Stay Inspired, Entertainment Gist, Movie Hour, Hits Paradise, among others. All designed to keep you thoroughly informed, entertained, at the edge of your seats and yearning for more. A tour around our domain will reveal a highly dedicated staff force and a state-of-the-art facility and equipment for high-definition quality broadcast, making our station your number one choice in advertising your business and propagating your ideas. We are currently on NightComSat doing our test transmission for takeoff in the nearest future. Television Nigerian is located in Nigeria at Television Nigerian House, Guzape Hilltop Mansion, beside Guzape White House, Guzape Abuja FCT, and in the United Kingdom at 45 Ancient House, 48 Aerodrome Road, Beaufort Park, Colindale, London. For inquiries, Television Nigerian, broadcast beyond boundaries.
The issue here we have to begin to look at is that at the time of independence, I don't know if there was a trajectory to where we are going to.
But how could it be that credible, free, and fair under manual conduct of election?
That is where our problem lies, and that is why people are now saying that, advising that we should move, that the world has gone into digital. We should move from the manual to the digital.
We cannot keep doing same thing and expecting a different result.
The only way you create jobs from your ministry is that you have to encourage local
But
content.
If you look at the profile of Sally Mama,
there is a caveat in this leave given to him. He should seek medical help if he's fine.
Welcome to Spectacle on Television Nigeria. You're welcome back. And this is Spectacle on Television Nigerian, and we're still talking about the primary healthcare facilities across the nation, the 10,000 primary healthcare facilities promised by the FG. And with me on the show, like I've introduced, is Dr. Mervis Robinson and Aji Robinson. Both of them are in the studio to help discuss on this very issue. Let me start with you. You are a fellow Institute of Management consultant, and you've been with the health sector for over a long period of time. What would you say, since 1960, we have been in the quagmire of, not affordable, non-affordable, and not equitable primary healthcare sector in the country?
Yeah, that's true. The country has been bedeviled with poor coordination, lack of infrastructure, and all that for the years. But recently, we are happy to say that the federal government, was able to sign into law the National Health Act, which has been made for the provision of the framework that will give the regulations to provide the framework, management, and regulations of the health systems in Nigeria, which is supposed to be anchored around the health system. Connotes the Federal Ministry of Health, State Ministry of Health, down to the, health communities in the wards, like you talked about. And this Health Act also makes provision for the basic healthcare provision fund, which in that fund is supposed to cater for the very vulnerable in the society. And that fund, the Health Act was signed into law, and it was backed with a provision from the 1% of the budget from the government, which will provide 50% of it will provide for the basic healthcare provision fund. 20% of it will go for the provision of commodities and vaccines, essential medicines. 15% will go for the infrastructure development of the facilities in all the wards. I think the pronouncement of the minister is supposed to, will get its own backing from that law. Using it's 1% of the total budget. So it is the division of that 15% of the 1%. It's what will be used for the, establishment, renovation, and whatever for the health facility that will be, that the minister has made pronouncement on. And if that is done, you will ensure that the basic provision and the basic healthcare provision fund will ensure that that vulnerable woman, that man will be able to get the healthcare that they provide. In Nigeria, what is bedevil is that why we don't access healthcare is because most of the money comes from out of pocket. And the healthcare.
When you say out of pocket, what does that mean?
It means that the provision that is supposed to be given in the hospital, maybe some free services that are supposed to be given in the hospitals, are not given. So you find out that people use their own money. Yes. So that's why people don't access health care in Nigeria. But with this law that is in place, it has put in place regulations, framework for the development of even the primary healthcare system. That 15% is supposed to be used
for infrastructure.
Okay. And however, for states to come into it, the pronouncement of the minister who says that in all the states,
yes,
all the wards in the country,
yes, and we have 812 wards.
Yeah. So we are not sure, because we are sure now, right now, that it's not all the states that have, put their own money, because the Health Act, yes, are supposed to give it their own counterpart provision of about, I think about 15% of their own state budgets. Is supposed to also provide funding for inside what the national, that is the federal government, is going to give 1%, while they will provide 15% to back it up, so that they too can benefit from this law.
Okay, the federal government is the one that is going to provide the infrastructure.
The federal government already has signed into law, meaning that nobody can come and change this. It's a law already. Yeah? So, and it has provided 1% of the total budget to provide for that aspect of basic healthcare for that common man. That, because you mentioned the vulnerable.
Yeah, the vulnerable.
That's what, because that is what the Act provides, that it must set aside 50% of that funding, of that 1%, to basic healthcare provision, which also insurance is part of it. But the basic healthcare provision fund caters for that vulnerable, and it caters for zero. It takes in consonant the this life cycle of humans. That's 0 to 5, 25 to these. All Nigerians are supposed to benefit from it, but mostly the vulnerable and the aged, So if the government, now we are...
And the disabled.
And the disabled. Yeah, they are part of the vulnerables. Children under 5, women of reproductive health, reproductive age, the age at 85. Is that 85 that... We are not so sure, the aged that are 85, because Nigerians don't really reach 85. So we're trying to see if government can reduce that age to maybe 65 years old, so that if you're 65, you can also access free healthcare from your own primary care. And this money is supposed to be disbursed through the National Primary Healthcare Development Agency, that will be disbursed through the state agencies, that is the primary health care within the states. Then the state will now disburse to the local government and to the wards. In the wards, in the primary health care wards, you have a system in place where the community comes in to take care of the primary health care. Yeah. You understand? And so it's supposed to trickle down through that system, which the primary health care, the framework that the Federal Ministry of Health is supposed to provide, that guideline that will ensure that monies are disbursed in a way that it ensures accountability. Yes. So that is what is, so that's, I'm sure the minister is talking from this backdrop of this 1%, which is now a law in the country, and which people can hold government to that word. Yes.
Okay, and you talked about it has channels.
Yes.
And these channels, are they coordinated or, by NIS, the National Health Insurance Scheme?
It's supposed to. You have the National Insurance Scheme different, and you have the Basic Healthcare Provision Fund different, but they are all from the Health Act. They derive their strength and their backing from the National Health Act, which has been signed into law in 2014.
Thank you very much, Aju Robinson, for that breakdown. Let me ask you, Dr. Mavis.
Yes, sir.
Do you think that what you've been experiencing as a medical doctor, that this particular 10,000 healthcare is feasible? Usual factors of corruption and so on, do you think this will see the light of the day?
Okay, you asked me the hard question. Well, okay, so from experience, from observation, I think it's possible. But to say it's possible is, you have to be as ambitious. You have to be very ambitious to think that it's very possible. But it is possible because of the system that has been put in place. Like Madam Aju was talking about how it comes down.
And that is where I have problems.
Like you asked about the coordination. So I think that when we get our coordination right, then we can start to have a good conversation about it. What I was actually thinking, why it wouldn't work. Let's talk about why it wouldn't work from my own perspective. I think it wouldn't work when we put our own needs, like our individual needs. You know, it's a very common...
Which is the Nigerian factor.
Yes. You know, it's very popular for us to say, you know, we've been hearing over and over again, Nigerians are poor, we are suffering, we are minimum wage conversation. So everybody thinks about their basic needs first, and it's not a bad thing to do, you know. When you talk about the Maslow's hierarchy of needs, you know, food and all these basic needs have to be satisfied
but this one
first.
is for the vulnerable, for the poor.
But even our leaders are still, all of us are still thinking of what we need to do first for our pockets before we think of. But if we can adjust our, you know, priorities. Let me put it as priorities. If we can adjust our priorities, our health priorities towards thinking like, what will my children, what is the legacy of our healthcare now? What should it be like in the next future? Do we need to still travel abroad? Do we still need to travel abroad for good healthcare when we can receive it in our own country? Believe you me, I know a lot of medical experts that are very, very, you know, good at what they do, but they don't even have the basic supplies to provide good healthcare. You know that this person needs a drug of only 500 naira, but is it from your pocket you will now help this person receive healthcare? No. So you see those kind of hindrances. This person needs a scan, or even basic, a pregnant woman just comes to the hospital. Yeah, you know, it's a whole cycle. There could be different instances. You know, I don't want to focus on one, but the point is, it's our priorities, our health priorities. What are they now? So when we can set our leadership, the government across all levels, if the health priorities are right and we agree that this 1% and this 50%, the 50% for the basic healthcare provision fund that comes to my own local government, like me from
50% of the national budget.
Okay, so like
national budget. Like I said, it is 1% of the budget, total Nigerian budget, right?
The
now
budget
that
is
1%,
$103 billion.
Well, so that 1% comes to the healthcare system through the Health Act. The government has already set aside that money. That money is available because it's part of the budget.
That one goes to.
So that 1% is now divided into 5 parts. 50% of the 1% goes to basic healthcare provision fund. Then 20% goes for essential medicines and vaccines. Are you getting me? 15% goes to the infrastructural development. Do you understand? Then we have another 5%, right? 5% goes for emergencies. It's supposed to take care of all the emergencies that will come. You know, before, if you go for emergency, nobody will take care of you. They will say, bring police report, bring all those things. Before you know, the person has died. You know, so that 5% is supposed to go to the primary health care center where that patient is receiving treatment, and that fund is supposed to come to take care of that person.
All right, so the government, the doctors and the nurses don't have rights to act under emergency situation now.
Well, there was a law that came in place one time. I don't know, it's the enforcement that is the problem, that says that you must treat first before you ask of that. Those things are important. Police reports and all those things, they are important. But
it's not necessary anymore.
It's important, it's very necessary, but it's just that they say treat before you start. Save the life first. But how many hospitals are doing that? People are still dying. But we are hoping that this 1% that it shows the prioritization, like she was talking, it shows the prioritization of the government, that now we have been fighting for the act and the Health Act to come into place for a long time, since when you mentioned. Now it has come in place. It was signed in by Goodluck in 2014, but now the money has been set aside in this government to make this.
And it was launched in 2005.
2014.
No, it was launched initially in 2005. Okay, the NIS was launched.
NIS, you know the Health Act actually took care, cognizance of all the needs, the MDGs, the provision just for ensuring the universal health coverage in the country. So it took cognizance of all those policies. The first policy that actually came in place was in 2004. That's the most comprehensive policy of health in the health system. But it lacked a lot of things because of emerging issues. Like right now, there is a policy that says there must be primary health care under one roof. Yeah, that means all the services, all the basic health services are supposed to be provided in one primary health care. It is part of this basic basic health care is supposed to take care of that primary health care under one roof policy, which has been reversed and reversed and reversed. And with the strategic plans that have been in place, it's just supposed, it's a beautiful thing if you read what that basic health care is supposed to do. Because people are supposed to access services, those basic health care, malaria for all Nigerians. Once you have malaria and you enroll in the program, you are supposed to enroll. Actually, you go to your primary health care closest to you and enroll. When you have malaria, you and your family can access health care free of charge. Yes, so for all Nigerians.
Audience, you are listening. It is free of charge. You can enroll. As a consultant is saying here, you can enroll just close by you from your primary health care.
That is for FCT, we're sure. The FCT has flagged it off in August. Yeah, and other states. Like I said, it's not all the states that have taken it. But for the minister to make that big pronouncement to say that it is going to happen in all the wards in Nigeria.
That's why TVN took on him immediately to follow it up.
Yeah, so we want to see the list. Right now, I think they say currently only about
43,000.
No, how many states have? Is it 9 or 17 states only that have signed into and brought their own counterpart funding? I'm not sure of the number. Only a few states. And we have 36 states plus FCT. But FCT is driving it right now, currently. And it's one primary health care is going to be made functional in every ward. In every ward of the FCT. And we have 62 wards in the FCT, but there is one primary health care center that will be made functional through the 15% of the BACF funding that has been made available. So for all the other states that are now that have brought their counterpart funding, that is supposed to be going on in their own states too. But we don't know when the other states that have not come on board will come on board so that this dream that our minister have will come into place. However, issues of putting accountability framework in place and on the BACF is lacking in the act.
That is where I want to
it's lacking in the act because it did not show where we can hold government accountable, though it says that the Federal Ministry of Health is supposed to provide a monitoring and evaluation and things around.
As usual.
As usual. But they didn't say who is supposed to monitor financing. Because this financing also comes, that 1% that government brings also is supposed to be financed also from philanthropies, donors. You understand? They're supposed to support the health. So, when donors come with their support, they put in structures to make sure that their monies are spent wisely. But the Nigerian government we don't know. So now I'm speaking, I want to see a place where when the states take it up, they institute an accountability framework that will ensure that monies are used judiciously and they can be accounted. Though the framework says that everything goes straight down and it goes straight to the benefiting primary health care center, but and it's supposed to be taken care of with the what they call them, World Development Committees in the primary health, because they are the ones that are in charge of the primary health in the wards. So they are the ones in charge of the financing. They will come up with their plans, business plans. What do they need in this primary? Let's take this place as the primary health care center in our ward here. So you have those people that are managing the hospital, which is the officer in charge. That is they call it officer in charge of the hospital, the OIC. You have the CHU. You have also the traditional
leaking right now.
Yes,
even the generator that
is part
the
of
World Health brought is there, not even packed off. It is not secured, and everything looks shabby.
Yes.
The building itself is an eyesore. So we are looking at Dr. Marvis. Let me ask you this question:
Yes, sir.
if this thing is actually going to be in place, will it address this issue of this new diseases? How do I call it? This scope
threats?
of disease threat like Ebola and so on, hepatitis, HIV and so on. Will this address this issue, and people will no longer have to travel abroad for medical care, or what is this all about?
Okay.
Please tell us, and your challenges as well as a medical doctor.
Okay. So what I wanted to highlight using this question, very nice question.
Okay.
It's the hierarchy of maybe how the health sector is broken down. She talked about it from a different perspective, but we have the healthcare, we have the administration of healthcare in Nigeria, and then we have the service where you're supposed to receive services from. Okay. So let's just look at it from an administrative perspective and from where you're supposed to receive service.
Okay.
So since the highest level would be our legislature, right?
Okay, yeah.
Because so we have the National Council on Health,
okay.
and then the National Council of Health gives, after them you have the Federal Ministry of Health.
Okay.
After the Federal Ministry of Health, you go into the State Ministry of Health,
okay.
and then after the state, then you have the local government agencies.
Okay.
Then that's the administrative part of it. So everything
That's the
is
system.
That's the system.
Yeah.
That's the system currently in place.
Okay.
Then when you go into the service, part of it, you still have the same structure, but like you have the tertiary healthcare service providers,
Yes.
then you have the secondary healthcare providers,
Okay.
and then you have the primary healthcare providers.
Okay.
So this is how you should look at it. So who is responsible for what, at where, when? So when we're talking about, let's use Benue State that you had mentioned earlier.
Yes.
So I believe there is a Benue State teaching hospital, or there's a government hospital, like there's a Benue State hospital.
Yes.
So that will be your highest level.
Okay.
That should be your state level, because it's the state. But at the federal level, we should have something like the National Hospital. I'm sure that you're familiar with that.
Yes.
So there's national, this is the federal, or you hear of something like FMC, so the Federal Medical Center, I believe there should be one in Benue State. Okay, so let's say Benue State Federal Medical Health Center, Benue. Then you have this Benue State Hospital. Then you have something like, I believe there should be, what would be
General Hospital.
General Hospital would be something like the secondary. Would be the secondary. General hospitals, yes. Then the lowest points would be the primary healthcare, Otubo. I don't know.
In the wards.
In the different wards. You have this small with blue curtain.
Yes.
Yes, I believe. So this is what it looks like.
Okay.
So what you're supposed to say is, so wherever you are in Nigeria at whatever level, urban, rural, so you're supposed to receive services at whatever level you are. Yeah. So what we're talking about here, I believe the minister was mentioning the primary health care.
Okay.
Yeah. So we're talking about primary health care. Okay. That's where it's the lowest, most accessible, let me not use lowest, the most accessible health care service, and that's what the primary basic healthcare provision fund is.
Ironically, it's not available, like it's been painted.
So that
is why I asked you to,
so this is where a good conversation should start.
Okay.
Who is responsible for our primary healthcare? It's the local government.
Okay.
It's the local government. They're responsible for staffing it. They're responsible for they're supposed to be responsible for funding the primary health care.
With a percentage given to them.
Yes, and that's why they don't have doctors, because they don't employ doctors. The local government has never written to the hospital management. I don't know, but I believe this is how it should work. Yes. They're supposed to write to the hospital management board or the national medical, the medical dentist and council of Nigeria, midwifery. They can write and ask for whatever staff they need. That's what she was mentioning. Currently, we have people like the CHUs and the OICs that are currently located in the primary health care. And if you notice, in communities, they also have, that we have the orthodox medicine, and our country actually recognizes three major ones: orthodox, traditional, and alternative medicine. These are the three ones that our government allows in the country.
Okay.
So in your local government, what you would see is the primary health care, and people will receive services based on the people that are there. So if the people that are there say they only want water bottle, if they ask for only water bottle there, it's water bottle they will get. If they say they only need, or our government is not working like it's popular. So what I want to really, this is my own ask. My own ask is for people at the local government level to start asking their local government chairmen and their leadership, what is going on in my own local government? Why don't I have the basic health provision fund? Why don't we have doctors in our community? I mean, we have people that travel from here to go abroad to go and study, or to go to the city
like
to go and study.
You schooled in Canada or so.
No, I schooled in Russia.
In Russia?
Yes, I did.
Right.
But so that's the kind of question that we should be having. Like, why is there no doctor here? Why don't we have this here? Like you said, the roof is leaking. You should ask the leadership of the state, the local government, what's happening?
As a matter of fact, I legislated in my ward as their councillor.
Yes.
I put up a memo to the local government chairman. It fell on deaf ears. I came again, I put up a memo. We made a law, regarding the primary health care. Nothing seems to also.
Now you can go back with this, because this is a law that cannot be waved aside. It's a law. Nobody can come and say it's not. It's the law of the country, and you are a citizen. You have the right to that. You can still revisit it. Like she said, this is where to start. Now, I understand there is a basic healthcare provision fund.
We don't have much time again, madam. I will definitely bring both of you here again. We will elaborate, probably not primary healthcare anymore, maybe secondary healthcare. We will discuss it, because healthcare matters. You can see our president is in faraway London taking medical assistance now. So this is where spectacle will stop today, and very soon these persons you see here, these experts will be here again to elaborate on secondary and tertiary healthcare facilities in the country. Thank you once again. I am still your host, Daniel Atai. Wonderful. Welcome to Spectacle on Television Nigeria. I am your host, Daniel Atai.